Heart failure is a serious medical condition. It affects millions of people worldwide. The heart, our body's tireless pump, can become weakened. When this happens, it struggles to circulate blood effectively. This leads to a cascade of problems as the body's organs are starved of the oxygen-rich blood they need to function. Understanding heart failure is crucial for aspiring nurses. Imagine a hose with a kink in it. Water flow is reduced, right? Similarly, in heart failure, the heart, like a weakened pump, can't push enough blood through the body. This can be due to various factors like damaged heart muscle from a heart attack or long-standing high blood pressure. The result? Fluid buildup, fatigue, and shortness of breath are common symptoms. It's a chronic condition that requires careful management. Recognizing the signs and understanding the underlying mechanisms are vital for providing effective care. As future healthcare professionals, you'll play a critical role in educating patients about heart failure, managing their medications, and promoting lifestyle changes that can make a world of difference in their quality of life. Heart failure is broadly categorized into two main types, left-sided and right-sided, each with its own set of telltale signs. Left-sided heart failure occurs when the left ventricle, the heart's main pumping chamber, weakens. This can lead to fluid backing up into the lungs, causing shortness of breath, especially when lying down. Patients often complain of fatigue and weakness as the body struggles to get enough oxygen. Right-sided heart failure, on the other hand, happens when the right ventricle can't keep up with the workload. This causes fluid to back up into the legs, ankles, and even the abdomen, leading to swelling. You might notice this swelling as indentations left in the skin after pressing on the swollen area. It's important to remember that heart failure can be either systolic or diastolic. Systolic heart failure refers to the heart's reduced ability to squeeze effectively, while diastolic heart failure involves the heart's inability to relax and fill with blood properly. Recognizing these different types and their specific symptoms is vital for accurate diagnosis and treatment. To truly understand heart failure, we need to delve into the mechanics of how the heart pumps. Three key factors come into play: preload, afterload, and contractility. Think of preload as the amount of blood returning to the heart after circulating through the body. It's like the amount of water in a hose before you turn on the faucet. In heart failure, the heart struggles to keep up with this increased preload, leading to fluid backup. Afterload, on the other hand, represents the pressure the heart has to overcome to pump blood out to the body. Imagine trying to force water through a narrow nozzle on a hose. It takes more effort. Similarly, conditions like high blood pressure increase afterload, making the heart work harder. Finally, contractility refers to the heart muscle's ability to contract forcefully and pump blood effectively. Just like a tired muscle, a weakened heart muscle has reduced contractility, making it less efficient at pumping blood to meet the body's needs. Understanding these three factors and how they are affected in heart failure is key to grasping the complexities of this condition. Section 4. Navigating valvular diseases. Beyond problems with the heart muscle itself, issues with the heart's valves can also contribute to heart failure. These valves act like gates, ensuring blood flows in the right direction. Two common valvular diseases are mitral regurgitation and aortic stenosis. Mitral regurgitation occurs when the mitral valve, located between the left atrium and left ventricle, doesn't close properly, allowing blood to flow backward. This can lead to fatigue, shortness of breath, and a heart murmur that sounds like a whooshing sound. Aortic stenosis, on the other hand, involves the narrowing of the aortic valve, which controls blood flow from the left ventricle to the rest of the body. This obstruction makes the heart work harder to push blood out, potentially leading to chest pain, fatigue, and even fainting. These valvular problems can significantly impact the heart's ability to function properly and may require medication or even surgery to repair or replace the affected valve. Understanding these conditions and their implications is crucial for providing comprehensive cardiac care. Section 5. Differentiating HFpF and HFrEF. In the world of heart failure, two terms you'll frequently encounter are HFpF and HFrEF. These stand for heart failure with preserved ejection fraction and heart failure with reduced ejection fraction, respectively. Ejection fraction refers to the percentage of blood pumped out of the left ventricle with each heartbeat. A normal ejection fraction is between 55% and 70%. In HFpEF, the ejection fraction is normal, but the heart muscle is stiff and doesn't relax properly. This makes it harder for the heart to fill with blood, leading to symptoms like shortness of breath and fatigue. Think of it like a balloon that's hard to inflate. HFrEF, on the other hand, involves a weakened heart muscle that can't pump effectively, resulting in a reduced ejection fraction. This means less blood is pumped out to the body with each beat, leading to fluid buildup and fatigue. Understanding the distinction between HFpF and HFrEF is crucial, as treatment approaches can differ. Section 6. Diagnosis, Treatment, and Lifestyle Changes.